First at 5, millions of Americans, including thousands of Michiganders, are starting the new year with the fear of losing health care coverage.
The subsidies put in place during the pandemic expired on January 1st, which some say will cause premiums to skyrocket and make health care unaffordable for many.
13 Your Side's Peter Elliott spoke with a health care expert this afternoon. He joins us now. And Peter, how is this being felt here in West Michigan?
Elena and Julia, we have heard from a number of viewers who are facing significant increases. One saying her rate has almost doubled this year. Another shares that her deductible rose from $6,000 to $20,000. One way or another, the expiration of these credits will likely impact the cost of your care.
It's a huge challenge for so many people.
Roughly 24 million Americans and 530,000 Michiganders left in limbo
Because it's simply too expensive.
as subsidies for the Affordable Care Act lapse in the new year.
In Michigan, for example, about 90% of people who are enrolled in the marketplace get those tax credits. And for all of them, premiums are going up.
Marianne Udall-Phillips lectures at the University of Michigan's School of Public Health. She says that without the tax credits, people of all backgrounds are facing significant increases.
And let's say they earn $90,000 a year, they go from paying $638 a month to $2,695 a month, 4 times what they paid last year.
Experts fear that these skyrocketing costs will force millions to go uninsured,
Which means we'll have people going to the hospital who can't pay their bills. That puts more pressure on hospitals who have people who have bad debts. They can't cover the cost of the care. That raises premiums for everybody who has coverage.
For those without insurance, a lack of preventative care can lead to dire consequences.
What we expect to see is many more people showing up in the emergency room where there's already long waiting times, who are uninsured and in crisis.
Udall-Phillips says these conditions will even impact those with employer-provided health insurance.
Those are people who become uninsured, and those bills have to go somewhere. That raises premium costs for everybody else.
Congress returns on January 6th. Back in the fall, disagreements over ACA subsidies triggered the longest government shutdown in U.S. history.
I'm not optimistic that they are going to pass the extension. A one-year extension costs $30 billion. Finding $30 billion for 1 year is a challenge.
Between 5 and 6% of Michigan's population is uninsured. Udall-Phillips says that number is better than the national average, but that number is expected to climb this year.